Hi, my name is Caitlin Cochran, and I chose to do my disease presentation on kidney infections. One of the major ways to tell what type of infection someone has is to observe the signs and symptoms that someone presents with. A sign is what is observed by someone else, like a medical provider, when you go in to see them because you have something wrong, such as the symptoms you're experiencing. The symptoms are what you notice or that you're experiencing from the type of condition or disease that you're infected with. Often the symptoms that individuals experience that causes them to go in to seek medical help are painful urination, or it being more frequent, or discoloration, or blood in their urine. Sometimes they have back or side or groin pain, which is when the kidney infection has progressed. The medical provider will observe different discoloration of the urine, and they will do a urine sample to test for the bacteria in the urine. They'll also take a temperature to see if an individual runs a fever, and then they might tap their back, which is the ankle percussion, to see if their kidneys hurt. The pathogen that most common causes UTIs and kidney infections is uropathogenic Escherichia coli. It's also called E. coli for short, and it is abbreviated UPEC for this type of diagnosis. E. coli is a gram-negative anaerobic rod-shaped bacteria with multiple flagella all across its cell surface. Virulence factors are molecules produced by bacteria that add to the effectiveness and ability to achieve colonization in a host. Specifically, in this infection, it would be inside the urinary bladder and the kidneys. There are two different types of virulence factors. One are bacterial cell surface virulence factors, and the other is secreted virulence factors. The bacterial cell surface virulence factors help adhere the bacteria to the host cell surface. It helps with tissue invasion, biofilm formation, and they consist of a lot of different types. One is a type 1 pili, which is essential for colonization and invasion with the persistence of this bacterial infection. The tips of the pili are an adhesion FIM-H, which recognizes and initiates colonization and invasion into specifically the umbrella cells. Another one is the secreted virulence factors, such as hemolysin, which is a toxin that targets multiple host pathways to facilitate infection. Then there are defenses such as the toll-like receptor 4, which defends the uroepithelium from the UPEC invasion. The pathogenesis of a kidney infection is the biological mechanism that leads to disease states. This begins with the urinary region that is contaminated with bacteria. Then the uropathogenic bacteria colonizes the urethra and ascends up to the bladder. The virulence factors then help the bacteria attach to the umbrella cells of the bladder. The body also tries to fight back, but the bacteria multiply and ultimately dominate the area. Biofilms that can form then in the bladder. And if you do not treat the bladder for a lower UTI, the bacteria will then ascend up to the kidneys and colonize there. This can cause host damage if it's not treated. This can also lead to bacteremia, which is bacteria in the bloodstream, which is not good and can ultimately lead to sepsis. This is the branch of medicine that deals with incidence, distribution, and control of the disease. Risk factors are a key component of if someone will have a kidney infection or not. If you're 65 years or older, you have double the rate of infection as other females. Uncomplicated UTIs typically affect women, children, and elderly patients who are otherwise healthy. And complicated UTIs are usually associated with catheters, UTI abnormalities, immunosuppression, or exposure to antibiotics. An individual's health can also affect how susceptible they are to reinfection or infection in general. Young women who are more sexually active have a higher risk of UTIs and kidney infections. Also, recurrent UTIs can cause anxiety, financial burden, stress, and depression in individuals because of the added component of getting this infection treated. Diagnosing a kidney infection requires a urine sample to test for bacteria, blood, or pus. The medical provider may potentially also take a blood sample, which will check for bacteria and other microbes in your blood. They could take a CT or an X-ray or an ultrasound to examine the physical aspects of the body. Antibiotics are the first choice to treat a kidney infection, and then potentially a repeat urine culture is needed to see if more antibiotics are needed. Different antibiotics are classified based on their mechanism of action on how they attack and kill the bacterial cell. Some disrupt the cell membrane by disrupting the phospholipid bilayer. Antibiotics bind the cell membrane to alter the structure and then make it ultimately more permeable. Some antibiotics inhibit cell wall synthesis, which cause bacteria to die, but they avoid the healthy cells since our cells don't have cell walls. Some antibiotics inhibit DNA or RNA synthesis, and they block the synthesis, so more isn't allowed to be created. And some antibiotics inhibit protein synthesis, which the bacteria need to make proteins in order to survive, so some of the antibiotics target the 30S subunit or the 50S subunit of the ribosome. To help prevent kidney infections and UTIs, improving your general hygiene is important by drinking lots of water, urinating as soon as you feel the urge and not holding it, urinating after sex, wiping from the front to the back when using the bathroom, not using irritated feminine products, and wearing more breathable clothing. Also, it's important to get treated early if someone experiences lower UTI symptoms so it doesn't progress into a more advanced, severe case such as a kidney infection.